His name, Dr. Christopher Duntsch.
The carnage he caused was not a mistake or an accident.
His weapons of choice, scalpels and surgical tools.
Has the appearance that the patients are treated like cannon fodder.
This has not happened in the United States of America, where you can do such a procedure and have such complications.
We, the jury, unanimously find that Christopher Daniel Duntsch guilty.
Duntsch got life. Convicted of injury to an elderly person, his botched surgeries led to 2 patient deaths, and more than 24 others were maimed or paralyzed. But this is not just a story about the notorious surgeon. It's about a broken system. It's called the National Practitioner Data Bank. The data bank was set up by Congress to flag bad doctors and protect patients. It requires hospitals, medical boards, and insurance carriers to report problem doctors.
It was created to prevent dangerous or incompetent doctors from traveling from hospital to hospital or state to state without being detected.
But a WFAA review found hospitals seldom report doctors who have been sanctioned or lost their clinical privileges. 424 of Texas's 662 hospitals have not reported a single doctor since the databank opened 3 decades ago. Nationally, it doesn't get much better. Half of the 6,500 U.S. hospitals have never reported. So have any hospitals been disciplined for not reporting? A databank spokesman told us in an email, there have been no formal investigations, hearings, or sanctions for not reporting since the databank opened in 1990. Now let that sink in. In 30 years, not one hospital has been investigated, let alone sanctioned for not reporting a bad doctor. Not even the hospitals that opted not to report Dr. Duntsch. Dr. Sidney Wolf is a well-known consumer advocate.
What it says is that the doctors who are operating or taking care of patients in hospitals are getting away with not being reported or not being disciplined.
Wolf says one way hospitals have skirted reporting requirements is by sanctioning doctors for less than a month.
Hospitals can discipline someone for 5 days or 10 days or 20 or 25 days. None of those are reportable.
Let's take a more surgical look at the Texas numbers. Even among those hospitals that have reported, most have only turned in a single doctor since 1990, according to the databank's records. So who are they? Well, you don't have the right to know that. You cannot know which hospitals have reported or how often. And the names of the individual doctors, well, those are off limits too.
The system failed us. The hospitals, everyone that knew, what Dr. Duntsch was doing, they all failed us.
One of Duntsch's botched surgeries left Angela Mayfield's husband a prisoner of his own body.
I have neuropathic pain, full body now, and it doesn't go away.
Duntsch's trial revealed how his bloody trail through North Texas began at Baylor Regional Medical Center in 2011. One surgery left Duntsch's own best friend a quadriplegic. A month later, Kelly Martin bled to death in another botched surgery. The hospital let Duntsch resign and didn't revoke or restrict his surgical privileges. As a result, they were not required to report him to the databank. Baylor even gave him this letter that helped him move on.
That loophole is used too often to allow doctors to quote, escape, end quote, to escape the consequences of peer review, the consequences of poor performance.
Baylor's Scott and White officials told us the hospital acted in accordance with the databank's guidelines, and they've strengthened their processes for screening and evaluation of doctors. After Baylor, Duntsch moved on to his next job. After just a few days at Dallas Medical Center, he cut through Floella Brown's spine. As she laid dying, he botched Mary Eford's surgery. The hospital withdrew Duntsch's temporary privileges.
We did not want to take a chance of harming any patients.
But they also let him resign. Dallas Medical Center did not report him to the databank, although the guidelines indicate they should have done so. Dallas Medical Center officials say they are under new ownership with a new administration and adhere to reporting guidelines and industry standards. Duntsch operated on Philip Mayfield at another surgery center.
When did you know something was wrong?
Immediately when I woke up from the surgery. I couldn't move from the neck down.
Why do you think it was allowed to happen?
Money. I honestly feel like that because of money.
After Mayfield's botched surgery, Duntsch operated for 2 more months, the last time at University General Hospital. There, he nearly killed Jeff Glidewell during what should have been a routine surgery.
It looked like Christopher Duntsch tried to decapitate Mr. Glidewell.
The Texas Medical Board suspended Duntsch's license in June 2013. Only then did University General report him to the databank. University General has since closed.
We failed. We failed as a profession to acknowledge, recognize, and try to stop somebody who is harming the public.
Remember, information reported to the databank about specific doctors is a secret. Duntsch would not speak to WFAA, but during the trial, his defense blamed his training and the hospitals that continued to let him operate. It's only because Duntsch was prosecuted that we know which hospitals did and did not report him.
The factors that caused Dr. Duntsch to get unleashed on the patients of Dallas could happen again.
3 years after Duntsch got life, many experts say the failed system that hid Duntsch is no different than before his first failed operation.